departments were there.
Hmm.
So I think state governments are also taking, you know, some very positive steps.
That's very good, actually. It's very required. It's highly required in this present context. Given the levels of malnutrition that we have, there's hardly any alternative. We have to go for compulsory fortification.
Yes.
I'm at home today because I got tested for COVID. So I'm in self-isolation.
I see. I see. I see. So it is required 14 days now.
No. Let me wait for the test report. I went to visit my mother and she was later on diagnosed positive.
So your report. So touch wood. I sincerely hope. And is your mother doing all right?
She's all right. There are no symptoms,
Okay.
but then she was positive. So since we go to office every day and others can get infected, therefore I thought let me get myself tested.
Yeah, you have so much of public dealing.
Yes. Public तो खैर आजकल नहीं आती ज़्यादा.
No, but it's a large ecosystem there.
So you have 85 participants. That is good, and the number is going up.
It's going up. We had I think about 800 registrations.
800.
Haji. Ab between registration and actual participants, I'm not sure what the benchmark ratio is, but I was informed there is somewhere close to 800. A lot of industry players are also expected to.
So let's wait for 10 minutes. I think we have time.
Sir, we start at 3.
Okay. I'll just come back.
Sure.
Dr. Halde has not joined. I don't see him in the list of panelists.
Hi, this is Shailesh here.
Hello, how are you?
I am fine. I did speak of Mr. Halde, Prabodh Halde had some emergency, so I am joining on his behalf.
Okay, welcome.
Most welcome.
Yeah. Hi, Dr. Preeti.
Hello, sir. How are you?
I am fine.
Hello, Tarun sir. Namaste, Arun Singhal ji.
Namaskar, how are you?
I am good. Thank you, sir.
Hello, Tarun ji. Namaste, sir.
Good afternoon, ji.
One day, Tarun, I'll take some tips from you about shaving my head. I think I'm heading in that direction.
I made the plunge about 7 years back.
Okay.
So I'm an early starter.
You're doing quite well, so I hope I'll follow in your footsteps.
Hello, everyone. Good afternoon.
Good afternoon, madam.
Thank
Good
you so much for
afternoon.
joining in. Thank you so much, sir. I'll just quickly see if the screens can, if my screens are being shared. So just,
Yes, we can see the presentation now.
Yeah.
this is the introduction. So we'll start
Yes.
with the introduction, and then we will have next Tarun, because he'll welcome. Then we'll have Sir, because keynote speaker, then Enoshi ma'am, then my presentation, then Dr. Shankar, and then we have the panelists. And I just wanted to share with you all that it's unfortunate that Dr. Prabodh Halde would not be able to join us. His mother is unwell, so he has requested his colleague Dr. Shailesh Ghodkar to join, and we have included his biodata. We also having Mr. Ganesh Kulkarni from Kargil, and we'll be having his name also. There's a call from Dr. Shankar. I'll just attend that. Hello.
Sure.
Yes, sir. Sir, Kanika. Okay, sir. Or it may be from GAIN. Okay. Dr. Shankar is also just joining in. So this works. And then we have another presentation from Enoshi ma'am. So this will be her presentation. I'll quickly, that yes, it runs. And then of course there is my presentation. From the panelists, we are not having any presentation. Sorry, panelists, we have limited time, but we know that you would be compensating it with all the inputs.
I think the panelists have many things to discuss. It's very comprehensive and the time given to them is very short. But I have been worried about the quality of premix. That is one thing on which I would like to have a good discussion and
Sure,
some good recommendations also. Because as of now, FSSAI does not license the premix manufacturers, and we don't really want to test the quality also. So what would be a good way of ensuring that the premix is of good quality? That is a matter of concern for us. So please have a look at that.
So that's a very valid point, and Tarun and I, we had discussed it with Enoshi ma'am also. We have a GAIN premix facility which accredits all the premix suppliers in India which are serving within India and globally, but it is of course voluntary for anyone to get it tested from global premix facility. GAIN would be very happy to set up a similar kind of a facility within India, in FSSAI or in Bureau of Indian Standards as per your advice, sir. So we are very much onto it and we really want to do it, sir.
So we need to discuss and thrash out the modalities.
Sure, sir.
Have we invited somebody from BIS today?
No, sir, not today.
Is premix within their jurisdiction?
Sir, they said that they are open to it, but we have not carried out any further discussions with them because we would be waiting your advice on it. If FSSAI can do it, nothing like it, and in case due to any reason it can't be with FSSAI, then perhaps we can look for other options.
Do you think premix would qualify as food? It would be within the definition of food.
So it's so that I think Arun Omlalji would be in a better position to answer.
It can be an additive, I'm sure.
Yes, it is an additive. Yes, it is an additive.
It's not a food really, yeah.
It's not a food.
It's not a food.
No.
But since it enriches food, maybe in one way or the other, it can be linked. Perhaps, I'm not sure.
Can I come in?
Sure,
Yes,
sure.
sure. Absolutely, we're waiting
If
for
I'm
you.
allowed to.
Yes,
Of course,
absolutely.
we have been asking you.
I'm Arun, basically from Hexagon Nutrition. Premix basically comes under nutraceutical, and nutraceutical is governed by FSSAI. So premix comes under food, And we've been doing this for the last at least 15 years plus.
So should there be a mandatory license from FSSAI for premix manufacturers?
Yes, sir, there is a mandatory license which is there.
Okay.
In fact, earlier what used to happen is we used to have an online registration for the premix manufacturer, for any food manufacturers, for FSSAI. Last 1 year, even we were talking to FSSAI and people around and insisting we should have a audit by FSSAI and get things done in the right way. Last 6 months, I presume there was an audit conducted by FSSAI. It was a third-party audit where our plants were audited. And with regard to our facilities and the machineries and the people that we have and the certifications, and probably very few people got cleared in this audit, which we really appreciated. Probably we are the one who are insisting the audit should be more stringent. And probably the audit should be as per international standards like GAIN, UNICEF, which they conduct their audit and send their auditors to our plant.
But as far as I understand, any licensee who takes a license from FSSAI has to get his product tested twice a year. That is mandatory.
Not twice a year, sir. Usually it is once in 6 months.
All right, and that is what I'm saying. Once in 6 months. So in that case, the quality of premix also must be getting tested.
Absolutely.
There should be no need to worry about it then.
So to be very honest with you, I don't think it is being tested like what we are testing food. The reason what I was given to understand, we don't have a facility here at FSSAI to do that testing. But we as a company, we are all out to help along with the developing partners to conduct that testing facility. Because like you rightly said, it is a must.
I think we are cutting into the time of the panel now. So it's time to start, I believe, isn't it? Can we start?
Yeah, we'll take this discussion later on, sir, along with you.
Sure, absolutely.
Thank you so much for your time.
Welcome.
I'll request Deepti ma'am to start with formally start with the proceedings.
Yeah. Hello, everyone. We are very happy to be hosting this national webinar, which is on edible oil fortification, moving from commitment to action. And we are very fortunate that we are hosting this webinar with FSSAI, which is the body to be taking this agenda of food fortification forward. So without adding anything from our side right now, may I please request Mr. Tarun Wij to kindly welcome everyone for this important webinar. And I would like to introduce Mr. Tarun Wij.
I think we've lost Deepti, so let me just begin the deliberations for today. Very warm good afternoon to everybody. Thank you so much for joining us for the National Edible Oil webinar, Edible Oil Fortification from Commitment to Action. Having been on the journey of food fortification for more than a decade, we would say not only commitment, we have seen an incredible amount of passion. We've also seen an incredible amount of collaboration across government at the central level, at the state level, industries, large industry, mid-sized industry, development partners, nutritionists, scientists, academic experts who've contributed in the scientific panel. And so India has accelerated in the last 5 years its large-scale staple food fortification journey. And as a development partner, one of the cogs in the wheel, we have been delighted to be associated and contributing towards this important journey. I think this webinar where we've all come together is being convened at the right time. COVID has, in fact, spread across the world and particularly impacted our country as well. And as we all know, when pandemics happen, it is the nutritionally compromised who suffer more. It is the vulnerable populations who suffer more because of lack of access and affordability of safe and nutritious food. Diets tend to go more towards staple foods, and therefore, in order to ensure that we don't see dips in the nutritional status of our population, staple food fortification is quite vital to be sustained and accelerated at this time. So once Ms. Anoshi Sharma, Director FSSAI, who also heads the Food Fortification Resource Center, will give us a keynote and the contribution and the journey that FSSAI has had in leading the edible oil fortification as a subset of the overall large-scale food fortification journey in India. We have representation from the premix industry. We have representation from large and mid-scale industry as well, from Marico and Mr. Rajesh Vijayvargia from Madhya Pradesh, Ms. Preeti Amritkar from Evicor EnviroCare Laboratories will be talking a little bit about the lab aspects of food testing. And I'm so delighted to have Dr. Rajan Shankar, the Senior Advisor and Director in Nutrition of Tata Trusts, who's also had a long stint at GAIN to guide the panel and take us through a holistic overview of what the status of edible oil fortification is now, where are we headed, and what are the critical steps the country needs to take this journey forward to conclusion. So thank you so much for joining us, and over to the moderators.
Friends, I'm very delighted to have Mr. Tarun Vij speak to you about what we are doing and why we are having this webinar. Now I would like to request our very honorable CEO FSSAI, Shri Arun Singhal-ji, to talk about FSSAI promoting the power of nutrition through food fortification. I would like to introduce CEO FSSAI to you all. And sorry, there is a little bit of glitch, and excuse me for that. Just a minute and I would be back. So may I request you to please give your keynote address, and I would be happy to share with everyone your accolades a little later. But just to begin, CEO FSSAI is the proud alumnus of IIT Kanpur. He was earlier the additional secretary with the Ministry of Health and Family Welfare. He has been instrumental in setting up AIMS type of institutes across India. He's very passionate about health, public health policy. Over to you, sir, for your keynote address. Thank you so much, sir.
Thank you very much, Deepti. That was very kind of you. Mr. Tarun Vij, Country Director, GAIN, Ms. Anoshi Sharma, Director, FSSAI, She is in charge of FFRC. She is director of FFRC also. Ms. Deepti Gulati, head of programs in GAIN. Dr. R. Shankar, director nutrition and senior advisor nutrition in Tata Trusts. All the distinguished panelists, members from the industry, and all other distinguished guests who are there with us today. I'm very happy that this webinar is being organized today in association with GAIN. As we all know, our country has a very high incidence of malnutrition, ranging from stunting and wasting on one end to obesity on the other hand. Nutrition is fundamental for good health and for ensuring proper growth and development. Addressing malnutrition saves lives, reduces inequalities, and builds strong individuals. Proper nutrition also facilitates proper functioning of the immune system, which can enhance our capability to fight diseases like COVID. While much of the malnutrition in India is due to improper calorific intake, a very substantial part is due to micronutrient deficiencies also. The situation in this regard is quite grim. A nutrition survey in 2012 revealed that almost 62% of the Indian population has vitamin A deficiency, and 50 to 94% of people suffer from vitamin D deficiency. These are seriously high figures. Now, there can be three possible strategies to address micronutrient malnutrition. There could be micronutrient supplementation, then we could have dietary diversification, or we could have fortification. Of these three strategies, food fortification as a strategy to address malnutrition is a good option because number one, consumption of staple food is quite high, quite easy. It has the potential to reach all income groups from the rich to the poor, and it does not require any change in eating habits, so no behavior change is required. Various studies have established the effectiveness of food fortification in reducing disease burden and improving quality of life, and with a good benefit to cost ratio. It is also recognized by the Poshan Mission as one of the cost-effective strategies to reduce malnutrition. On its part, FSSAI as a regulator notified fortification of foods regulations in 2018 for 5 staple commodities. Amongst these, refined edible oil has been selected to provide vitamin A and D to our population. Since the fortification standards were operationalized, top players in the open market have fortified either one of the variants or their entire product range. The total fortifiable edible oil in India is estimated to be 11.5 million metric tons today per year. Pan-India players are fortifying 2.76 tons, and MSMEs are fortifying 5.18 million tons. On adding these figures, we estimate that the percentage of fortified edible oils in India is already about 69%. Presently in the open market, there are about 80 brands of fortified edible oil which are available. So with this considerable traction of oil fortification, FSSAI has now proposed for mandatory fortification of oil and milk in the open market. This is in line with global practices. The effectiveness and safety of edible oil fortification in reducing vitamin A and D deficiency is acknowledged globally. Mandatory oil fortification legislation was first introduced in 1965, and since then 27 countries have already made it mandatory. The technology of fortifying edible oils is very easy. Food industry has moved forward on oil fortification in a commendable manner in the past few years. The Ministry of Women and Child Development and the Ministry of Human Resource Development have already made fortification mandatory in their schemes. We are now, I feel, well equipped in terms of manufacturing capacities to make fortification of all oil mandatory. So the industry has to start preparing now for implementing this mandate in the interest of good health of all our citizens. In order to facilitate the food industry and state governments, FSSAI has set up the Food Fortification Resource Center, FFRC. Its director, Ms. Inoshi Sharma, is here with us today. FFRC has been working in collaboration with the member organizations of the POSTIC network to support and promote certification by providing end-to-end technical support. This center is at your disposal for any problems any stakeholders may face. Our past performance has emboldened us to propose mandatory fortification. I am sure we can collectively rise to the occasion and do this. On our part, we will be willing to assist in any manner that we can, but planning and preparation has to be taken up by the industry in order to succeed. I wish you all the very best in this endeavor. Thank you.
Thank you so much, sir, for sharing your very valuable views on food fortification. And indeed, I would love to share with everyone a brief about our CEO FSSAI. As I mentioned, he's a proud alumnus of IIT Kanpur with electrical engineering. He has a rich work experience of 34 years. Prior to joining FSSAI, Shri Singhal was the additional secretary in the Ministry of Health and Family Welfare. He has been very actively involved in drug and food regulation, medical education, and implementation of a very important scheme, which is Pradhan Mantri Swasthya Suraksha Yojana. He has played a key role in the expansion of institutes like AIIMS Delhi, PGI Chandigarh, JIPMER Puducherry. As a brilliant administrator, he has brought in major reforms in diverse sectors such as petroleum, natural gas, industrial development, rural development, agricultural marketing, and health and family welfare. No wonder, sir, you bring so much of wisdom to FSSAI, and being an electrical engineer, you have electrified the atmosphere. And we know that food fortification, specifically oil fortification, would lead us to a very healthy nation very soon. Thank you so much, sir, for your very enriching keynote address. We are grateful. Our next speaker would be Madam Inoshi Sharma. She would be speaking about the role of FSSAI in scaling up and the support that FSSAI has provided in edible oil fortification. She is an eminent civil servant from Indian Revenue Services. She has led the teams for enforcement of tax laws and ensuring tax compliance. As Director, National Health Mission in Haryana, she led the government's agenda of improving women and adolescent health with a special focus on menstrual hygiene, weekly iron folic acid supplementation, etc. And I had the privilege of working with her during that time. As Director FSSAI, she is leading the social behavior change communication, Eat Right India initiative, besides supporting and promoting staple food fortification. Her passion to support everything related to nutrition and health is unmatched. She's a multi-talented bureaucrat with a very rich expertise and experience ranging from international taxation and vigilance, publicity of tax provisions, public policy, administration, to social sector reforms and transformation. So over to you, ma'am, for your session.
Thank you so much, Deepthi. That was just amazing the way you said it. I couldn't recognize myself. But it's really amazing that you've got almost 600 plus participants here. And what's, one of the very, will my PPT be coming up?
Yes, ma'am.
Okay, fine. So I'll keep speaking.
Yeah, you just tell me and I will start, ma'am.
Hanji, you please put it on. I'll keep speaking, that's okay. I mean, what's really wonderful is with such a vast number of participants is that, the recognition that people have, from the oil industry, that fortification is so easy when it is a part of the oil that we are consuming every day in cooking. It is so picking up, say, a particular oil which is fortified. You really don't have to think much. Is it fortified or not? If all oil is fortified and you're buying it and you're adding it in your food, everybody in the family is going to have that food and they get the benefits of it. So at FFRC, we have created, a resource center where technical assistance is provided. All the information is available on our website. Technical information with regards to who are the premix manufacturers, from whom it can be procured, how much is to be mixed, who all are the big players in the oil industry who are already providing fortified brands. They are also listed. So it becomes a good platform for the industry to get information as well as, you know, put up their products. Because a number of times, if suppose the government or even consumers want information, they do refer to our website. So I would really recommend the industry to come forward, get the plus F endorsement, fortify their oils, and then please share your pack screen so that we can put it on our website.
Ma'am, do you want me to run through and would you like to advise further or?
So you can actually just come to the third slide. So yeah, this one's fine. Actually, this one's fine. The one that you were on, because this is just the standard that we've got with regards to vitamin A and D, which needs to be added in the oil. And the next slide, please. This is by and large our role. We also provide training. We do a lot of advocacy. Next, please.
May I request all the other panelists to be on the mute and switch off their videos so that there is no problem. Over to Inoshi, ma'am.
Yeah, the sixth slide, please.
Ma'am, there's a little bit of a problem.
Okay. Should we ask?
I'm just restarting your.
Okay.
I'm so sorry.
No, that's okay. I can keep speaking actually.
Yes.
Because there is just some very important information which I want to share with the industry is that we've already got regulations in place. And shortly we will probably be also making oil mandatory. So all oil in the country which comes out for the consumers, which is blended, has to be fortified. And so the support that we provide to the industry, as you can see from here, is we've got labs which are equipped for fortificant testing. We already have these labs notified. So any industry which wants them to get tested can do that. In fact, on our website, we already have the information which every premix has to fill up. The once in 6 months testing that has to be done mandatorily has to be uploaded. So if the industry is interested in getting a premix, they can also check the information regarding the premix supplier on our website also. So next, please. In case somebody wants from the industry some sort of training assistance from us, in case they want some information from us, you can always email at the FFRC link that is there, the email which is mentioned there on the website, and you can always pose your queries. Oil is a commodity which is, you know, part of the food safety network. So the Ministry of Women and Child Development, the MHRD, the ICDS program, and under some places in PDS also, it is being provided. So there is a lot of demand. So as you can see, this is our portal, www.ffrc.fssai.gov.in, where these 5 staples are mentioned. In yellow, we have edible oil. If you just click on that circle, you get a lot of information regarding oil. As you can see, this information comes up. You get information about the industry which is already providing fortified oil. So you also get a chance to be presented here. we also do a lot of branding of the fortified products in the big retail showrooms, where we say that just put up the plus F dangler. So we encourage them to put up products which are plus F in one place. So if your oil is fortified, it can always be placed there. We have a lot of IC material which we've created. The industry can always, work on those. If they want to do IC for themselves, that can also be done. Next, please. And these are our partners. We've got Tata Trust in milk, oil, and DFS, and GAIN, with whom we are doing this program for today, is there in milk and oil and wheat flour. And of course, for oil, since GAIN is available in most of the states in the country and are so easily accessible, I would request all of you to reach out to them for any queries or issues. So thank you so much, and over to you, Deepti.
Thank you so much, ma'am. And I'm extremely sorry for there was a network problem. And when you want everything to be going the best, you fall short. So I'm extremely sorry for that. And now, of course, it is going to be my presentation, which we would be talking about edible oil fortification, bridging the gap. So if I'm able to do it, I would love to talk about what we have been doing on edible oil fortification. So what we are going to talk about is how vitamin A and D, when they are added to edible oil, they help to bridge the nutrition gap. I hope you can all see it. Good nutrition is central to growth and development.
No, we can't see your presentation.
We can't see your presentation.
Okay, I'm sorry. I'll just see once again what went wrong.
You have to share your screen.
Yes, I have to share my screen, and there's something went wrong with the net.
It's fine. It's there now. Thank you.
Okay, so so we all know that nutrition is central to growth and development, and it defines our health and life. It is very important for us to know why we should be focusing on micronutrients. Good nutrition in general, and more specifically the micronutrients, which are the vitamins and minerals, promote growth intellectually as well as physically. And adequate micronutrients in our diet lead to good, healthy life. What we have been doing, are you able to see the screen?
Yes,
yes, we can see the screen. Can you please make it full screen?
Sir, I'm trying, but there's something.
Yes, exactly. This is the thing. Yes, this is. You have to click this at the bottom. Yes, okay.
Yeah.
It's not yet full screen. It's not full screen yet. Anyway, it doesn't matter. Please carry on.
There's something going wrong, sir. So, yes. So, good nutrition in general, and more specifically, the micronutrients promote growth. Adequate micronutrients in our diet leads to good, healthy life, protect us against nutrition-related disabilities, improved immunity and protection from illnesses, higher cognitive and learning skills, high achievement in school, better school work productivity, better wages, and hence prosperity. Vitamin A and D also contribute immensely to all of the above. If we look at the vitamin A and D deficiency in India, we find that in different states, as per the NIN survey, vitamin D deficiency ranges from 50 to 94%. And we also have vitamin A deficiency ranging from 62% as a pool data across the country. So India does have a very high burden of vitamin A and D deficiency, which impacts all of us. Food fortification, as you all know, is not a new idea. And if we look at the global timeline, it started with fortification of milk, fats, and oils in Canada in 1918. And we are already 102 years behind. And as you can say, now we are catching up under the leadership of FSSAI very quickly. So we need to move forward quickly with determination. Food fortification works, as can be seen that in 1944, when Canada introduced fortification of margarine, within 4 years, vitamin A deficiency came down from 48% to 2%. And that's something that we hope we can also do. When we look at our CNNS data and we look at our NFHS4 data, what we find is that at all India level, undernutrition ranges between 36 to 50% depending upon the type of indicator we are using, and it is the same case in Rajasthan. When we look at how many children receive vitamin A dose in the age group of 9 to 59 months, it was 60% at all India level.
I don't know why she's so nervous.
And 39% in Rajasthan. And when we had it in the CNNS survey, what we found is that there was 21.5% vitamin A deficiency at the all India level, and it was just 1.9% in Rajasthan. Maybe we have been able to contribute something. So strategic advantages everyone has already talked about. I'm not going to share it. There is enough of regulation, which Madam has already talked about and Sir has already mentioned. So what we would like to say is share with you the India footprint, wherein we can show you that 84.5 crore persons are being reached with adequately fortified edible oil through GAIN's efforts in 16 different states. And of course, we are working in milk as well as wheat flour, and together reaching 89.1 crore or 891 million persons. Food fortification does have a rich return on very low investment. Use of fortified oil in food safety net programs like ICDS and MDM gives them a healthy start, and that has been actually strongly recommended by our Honorable Prime Minister. So let's not miss out on the opportunity. Oil fortification in India improves health and quality of life. We are committed to action. So let's join hands to improve the quality of life of all. Let's eat right. Let's eat fortified. Thank you so much. And now I would like to introduce Dr. Shankar, who was our earlier director. As you can see, he has an exceptional career spanning over 42 years, including 24 years in Army Medical Corps. He headed the Thyroid Research Center at INMAS, DRDO. He was the Regional Technical Advisor at Micronutrient Initiative, and he was also the Project Director with UNICEF. His area of, and he has been, he is the one who set up GAIN India in 2006 and was the regional representative for GAIN South Asia before joining Tata Trust in 2015. His area of specialization are internal medicine, endocrinology, and public health, contributing immensely to the elimination of IDD and micronutrient deficiencies in India and South Asia. He has received many awards and accolades, first being Sir Sri Ram Memorial Award by National Academy of Medical Sciences, India in 1997, Sivanti Adityan Gold Medal by Association of Physicians in India, and he has over 100 scientific publications in national and international journals. So over to you, sir, for your presentation on the strategies for improving health of people through food fortification.
Namaskar. Good evening, and at the outset, thank you, Dipti, thank you, FSSA again, for giving me this opportunity. Shri Arun Singhal sir, Enoshi ma'am, Tarun, Dipti, and all other participants in this webinar, a good evening to you. As you know, we've heard from the CEO FSSAI, and also from Ms. Inoshi that FSSAI has made the necessary enabling provisions for food fortification in general to make its important contribution to improving health of people in the country. She also said about what is in the annual that we might soon have a legal provision to ensure that this benefit is not only to those who are able to access uh, voluntarily fortified certain brands, but then it will go across. But we all know that the potential for success of any food fortification project depends on few factors. First one, the first one depends on the food vehicle that we choose, and does the vehicle reach everybody? What proportion of that food vehicle that is consumed that is fortifiable? From that perspective, edible a very good food vehicle to fortify because it has such good penetration. It reaches one and all. Almost everyone consumes oil. The quantity that you consume may vary depending on your economic status, but then it reaches everybody. From the point of view of what is fortifiable, fortunately, this industry has significant amount of consolidation. That is, there are major players who contribute to a significant proportion of the edible oil, and even the lower down that the level of sophistication is much higher. So that gives confidence that this is the right vehicle and it can be easily done. The second one and most important is how effective is the quality control and quality assurance that is done. We have, as the CEO FSSAI and director pointed out, we have a very good enabling provision here available, but we need to really ensure that the quality is correctly maintained and the quality assurance, quality control are paid enough attention. From that perspective, it starts from what the CEO was talking about today before we started about the quality of the premix. It starts with quality certification of the premix to what you do as an internal quality control at the production level, and then external monitoring by a third party of how it is done at the factory level and along the supply chain, at the market and at a household level. All this over a period of time, verified by impact evaluation, would say that the program, that is fortification of foods, is contributing to reducing the vitamin mineral deficiency. So I'm very happy that we have assembled a panel where people who really do this and people who monitor it, you have premix manufacturers, you have laboratory people, and so we would like to really hear from them and learn from them what are the what really made them get into this and do it when it has been a voluntary regime. We would like to salute the industry for what they have done so far. Today, as a voluntary measure, we are reaching nearly 800 million people across the country with fortified edible oil. So we would like to hear from them. What is the motivation? What made them do? What are the constraints that they've had? We have the laboratory people to say what are the constraints they face in monitoring it, and also any suggestions that they have going forward as we move to universalize this. So I would, Deepthi, I think that this is very well constructed. And once, if you say that we move into the panel, if you introduce the different panelists, we can hear from them and I can moderate the session. Thank you very much for this opportunity.
Sure, sir. I just want to introduce the panel to you, and our first panelist would be Dr. Ganesh Kulkarni. He is the head of regulatory R&D at Cargill. He has a very vast experience, and in fact, Cargill was the first oil company that started fortification in India. And then I would like to welcome Dr. Shailesh Godikar. He is the multidisciplinary industry. He has the multidisciplinary industry experience of 26 years in food technology and quality management systems. His focus and passion is to drive consumer-driven quality agenda. His areas of specialization include development of quality systems and processes across the value chain. He has a lot of experience in quality certification and accreditation. He is a very, very innovative leader, and he has received awards for innovative leadership in quality. And he's also among the 50 most impactful quality professionals. And he has also received the award for global performance for excellence by the International Pacific Quality Organization. And on a softer side of Mr. Shailesh Godikar, he has been recognized by the World Health Organization and Ministry of Health and Family Affairs for his contribution to supporting Cancer Patient Aid Association for the past 11 years. Then we also have Shri Rajesh Vijayvargiya. He is the quality manager with Evi Agri Business Limited. He leads the quality control department in this organization. He has been doing so for the last 29 years. And his special forte is soya industry quality control. What I would like to add is that Evi Agri Business started with oil fortification way back in 2013 with GAIN support, and they have reached out to the entire Madhya Pradesh and the neighboring states with very high quality soybean edible oil. He has rich expertise in research and development, especially soya solvent plant, soya lecithin liquid, and oil refineries. We also have on our panel Shri Arun Omlalji. He is the Vice President of Hexagon Nutrition. He has nearly 3 decades of experience in consumer durables and nutraceutical industry. He has built some of the most well-known brands in the country in the area of nutrition. Under his pragmatic leadership, Hexagon Nutrition won the Best Nutrition Company Award by ASSOCHAM Nutrition in 2017. His areas of specialization include rich expertise in nutrition, nutraceuticals, and food fortification segments. He has been awarded as the Best Healthcare Entrepreneur by the World Health Congress in 2016. And he is a proud alumni of the reputed Narasimhan Institute of Management Studies, Mumbai. And we also have on our panel, Madam Dr. Preeti Amritkar. She's currently the Director Labs at EnviroCare Lab, one of the best labs that we have, which is a private lab. She has a rich experience of 14 years in analytical testing field. She works as a technical assessor in the field of environment and residue analysis for NABL. She's FSSAI Master Trainer for Pesticides and Mycotoxic Analysis in Food. Her area of specialization include residue testing, micronutrient testing, method development, etc. And she has a PhD in chemical technology from ICT Mumbai. So we have a very, very rich panel. And over to you, sir, Dr. Shankar, for taking the panel discussion forward. Dr. Shankar. Over to Dr. Shankar, please.
I think Dr. Shankar is on mute.
Today, something seems to be going wrong, but I'm sure Dr. Shankar would be back. But while Dr. Shankar joins us, may I please request Mr. Shailesh to talk about his experience in scaling up, initiating and scaling up edible oil fortification at Marico, and how has been his experience in the consumer acceptance.
Yeah. Thank you, Deepthi. I think it's a wonderful to be here in the front of the esteemed dignitaries. First of all, I like to talk about Marico. As one, Marico's core value is consumer centricity. And I think it's living to the core value of centricity. I think we sharply focus on emerging consumer needs. And I think this was an emerging consumer needs, which we thought that they wanted basically vitamins and minerals in some form. And we also believe that we need to create and deliver solution with the highest standard of accuracy, quality, and speed. So to meet this consumer expectation. So as a company, we believe that what is right for the consumer, we should design and deploy it at any cost. So we immediately took a decision that we should implement this fortification, and it was implemented in, if I recollect well, in August 2017. We saw these benefits. Okay, we saw that the benefits the consumer will get, and considering the fact and living to our values, we decided and implemented this. I felt that I think it was very important when we implemented it. There were some challenges which we do faced. The first was basically what we said: when the raw material comes, when the premix comes, we will ensure that quality will not be compromised at all. So each and every batch was tested for the design specs. The second thing, we also focused on minor aspects like it was stored properly in the AC conditions so that it does not get deteriorated. The third was, okay, we made a complete SOP so that this premix was mixed with and a pre-blend was made, and we put stringent checks and controls at our in-process and at our FG checks. So during when the batch was being dispatched, we made a qualitative analysis, and the quantitative analysis was done at the external there. And most important, what we did is, I think it was very important for each of our consumers to understand while they will see on the pack that it is fortified. But what we did innovatively is, on the National Consumer Day, we run a campaign, okay, that the oil is fortified, and we said what are the benefits of vitamin A and vitamin D. Second thing, on a call center also, we put a IVR stating the benefits of basically the vitamin A and vitamin D. And so this is the way we did a awareness session for all the consumers. And today also, we are continuously doing this so that the consumer gets enriched with the benefits.
Thank you so much, Mr. Shailesh, for sharing your views. May I now also respect Mr. Ganesh Kulkarni to share his views on the quality assurance, quality control, and also mention two key issues that you may have faced with respect to quality of edible oil. Now, Dr. Shankar has been able to join in, and I will hand over to you. But in line with our pan-India players who are working on oil fortification, may I request Ganesh Kulkarni ji to share his experience on quality assurance, quality control. Over to you, Ganesh.
Okay. So I hope I'm audible.
Yes, very much.
Perfectly fine. Thanks. Thanks a lot for this opportunity. I think Madam Dipti Gulati has already mentioned that Kargil was a pioneer. So Kargil has done the food fortification, or maybe I would say more on the oil fortification, since 2008. So 2008 was the first year when we started doing the fortification in our oils segment, and that started with vitamins. That's fat-soluble vitamins A and D. That's the first thing which we started. So we have currently, I would say, more than 12 years of experience now in doing this, and then we have been helping all the industries, either it is the small scale industries or some of our vendors, and to all of them, how do you actually do a food or oil fortification in terms of fat soluble vitamins. So
Ganesh, may I just request you? Ganesh, may I just request you to please, keeping in line with the time that we have, please focus your comments on the two common issues that you face with respect to maintaining quality and adequacy of fortification.
Okay, so common problem or common something which challenges we should moving forward look at it is basically all of those vitamins, it comes as a premix. So most of the industry uses as a premix. Okay, so none of the industry does their own premix. So everything is coming from the premix industry. So we are largely dependent, and making sure it's more of a quality assurance model. We are already making sure that the suppliers or vendors who are supplying the premix to us are completely compliant in terms of their food safety, quality, and the regulatory norms in this case. So that's one of the challenge, that we are completely dependent on the vendors, and all the industry is completely dependent on the vendors in this case. Okay, so that's the major source of it. That's first. Second thing is basically the supply chain, total overall supply chain. Maybe at one point of time in the COVID times, there was a lot of challenges for getting some of these premix from the vendors. That's because of the logistic challenges and multiple challenges. So that's one of the challenge we should look at it. And third challenge, it's after 45, you actually go into a supply chain. That supply chain is very much open. It's not a completely controlled environment, controlled atmosphere supply chain. I think people have to be very cognizant about the fact that the packaging material which we are using, and the temperatures where we are operating, everything has to be considered by FSSAI, by all the agencies like GAIN, everyone, to understand what exactly needs to be final workaround on our premix.
Thank you so much, Ganeshji. Now over to Dr. Shankar to steer the panel.
Dipti, please continue. Very, very bad internet. It is coming and going. Dipti, please continue.
Okay, sir. Thank you so much. It's been strange that today everything is going a little different, but I'm sure our audience understand that. Now I would like to request Mr. Rajesh Vijayvargiya from Avi Agri to come on board, and we would like to request him to share what made Avi Agri, which is considered to be a mid-segment and not a pan-India company, to be voluntarily adopting oil fortification, because you have a big presence in the entire central part of India and also overseas, I know. But specific to edible oil fortification, what made you start? What were the challenges that you faced? Were there any issues with respect to consumer acceptance? So over to Mr. Rajesh Vijayvargiya ji. आप please खुल के हमें बताएं कि आपने क्या-क्या समस्याएं आपको आई, क्योंकि हमने आपके साथ काम किया है और हम आपके काम की बहुत तारीफ भी करते हैं और आपके बहुत शुक्रगुजार हैं।
जी मैडम नमस्कार, मैं राजेश विजयवर्गीय, अभी एग्री बिजनेस लिमिटेड। समस्या तो अभी फर्टिफिकेशन में हमको नहीं आई है मैडम। 2012 से हम लोगों ने फर्टिफिकेशन स्टार्ट किया था गैन और सिकोडिकॉन के सपोर्ट से, और विद इन 2 इयर्स सिकोडिकॉन और गैन का काफी सपोर्ट रहा हमको, और हम इसके बाद में अभी तक कंटिन्यू है टिल डेट। और फर्टिफिकेशन में हमने जब स्टार्ट किया फर्टिफिकेशन, उस टाइम हमारा जो प्रोडक्शन था 750 मेट्रिक टन, और एट प्रेजेंट हम लोग 15 to 2000 मेट्रिक टन प्रोडक्शन कर रहे हैं फर्टिफिकेशन का। ऑयल जितना फर्टिफिकेशन होता है हमारे यहाँ, हम उसको पैक्ड ऑयल के रूप में सेल करते हैं, बट हमारा जो कैपेसिटी है फर्टिफिकेशन ऑयल का वो है 9000 पर मंथ, 9000 मेट्रिक टन पर मंथ। 8% जो प्रोड्यूस करते हैं ऑयल वो है 6000 मेट्रिक टन पर मंथ। बट हमारा जो कंज्यूमर पैक है हम लोग 1500 से 2000 मेट्रिक टन का सेल करते हैं। अदर ऑयल हम लोग जो है वो लोकल सेल करते हैं ऐसे बल्क में। तो वी रिक्वेस्ट, हम लोगों का रिक्वेस्ट है। यस
सर, मैं ये पूछना चाहूंगी कि जब आपने फोर्टिफिकेशन शुरू किया तो क्या कंज्यूमर्स को तो उस वक्त फोर्टिफिकेशन के बारे में पता नहीं था, तो क्या आपका कोई भी एडवर्स फीडबैक आया कि ऑयल अच्छा नहीं है, इसको तलने में या इसकी खुशबू में या इसकी किसी और चीज में समस्या आई?
मैडम नहीं एडवर्स फीडबैक नहीं आया, बल्कि सपोर्ट रहा हम लोगों का। और जब हम लोगों ने लेबल के ऊपर विटामिन ए एंड डी को इम्पोस्ट किया तो मार्केट से ये बड़ा फीडबैक रहा कि आप लोग विटामिन ए एंड डी भी ऐड करते हैं ऑयल में। तो हम लोगों को काफी सपोर्ट रहा मार्केट से और एडवर्स सिचुएशन नहीं आई है।
सर, ये आपका कहना हमारे लिए एक बहुत ही बड़ी सफलता है, क्योंकि आमतौर पे सबको जो मुश्किल आती है वो यही इसी बात पे शुरू हो जाते हैं कि शायद फोर्टिफिकेशन से कलर, टेस्ट, इन सब में फर्क आ सकता है या उसका तलने की प्रक्रिया बदल जाएगी। सो आपने इसके लिए हमें अश्योरेंस दिया, उसके लिए बहुत बहुत धन्यवाद। यस सर।
छोटा सा प्रश्न मुझे पूछना है इनसे, राजेश से। ये हमको गवर्नमेंट से क्वेरी आई कि हमने दूध में और ऑयल में फोर्टिफिकेशन मैंडेटरी करने का प्रस्ताव भेजा था। उन्होंने पूछा कि आपने घी का क्यों नहीं भेजा? तो घी में या देसी घी में कोई दिक्कत होगी क्या फोर्टिफिकेशन करने में?
नहीं, फोर्टिफिकेशन में कोई दिक्कत नहीं सर। मैंने दिल्ली में एक एफएसएसआई का सेमिनार अटेंड किया था मिस्टर पवन अग्रवाल के सपोर्ट में, और मैंने खुद ने सजेस्ट किया था कि एमपी में फोर्टिफिकेशन मॉनिटर किया जाए, क्योंकि अभी लूज ऑयल जैसे हम लोगों का प्रोडक्शन है 6000 मेट्रिक टन और हम लोग 4000 मेट्रिक टन ऐसे लूज ऑयल पैक कर सेल करते हैं। तो लूज ऑयल जो लोग खरीदते हैं हम लोगों से, वो फोर्टिफिकेशन नहीं करते हैं। तो मैंने उनसे क्वेश्चन किया था कि आप मॉनिटरी करिए एमपी में, और जितने छोटे पैकर हैं जो हमसे ऑयल खरीदते पैक करते हैं वो भी फर्टिफिकेशन करके विटामिन ए और डी को ऐड किया जाए।
एक और सवाल 15 लीटर की सीमा का है। 15 लीटर का जो हम लोग रखते हैं उसके बारे में आपका क्या विचार है कि कोई
15 लीटर तक हम लोग करते हैं सर, 15 केजी 15 लीटर। और हम लोगों ने ये भी सपोर्ट किया था उनको। हमारे यहाँ एफएसआई की अभी टीम आई थी, 5-7 लोग आए थे। उनको हमने बोला कि जो लोकल कंज्यूमर है, लोकल जो सेल करते हैं, लोकल जो पैक करते हैं,
सर आपका I think
I can give some more inputs to that to CEO sir.
Yes.
Yes.
So on the 50 liter side, sir, what you are asking, hello.
हाँ जी गणेश जी बताएं।
So on the 50 liter, so the maximum thing which goes for a B2C consumption, which is going to the consumer, would be limiting to up to a 15 liter size. Okay, above that, consumer doesn't buy anything above that. Okay, most of it something which goes into tanker size, about 20 metric ton, 30 metric ton, that goes for a B2B consumption. That's a further processed. So it is given to the industry where it is utilizing in confectionery, it is utilizing in bakery or frying, convenience, and other products altogether. Okay, so I think it should be around 15 liter. That's what we said. First question which you asked for the ghee side, ghee naturally do have vitamin A which is already present. It's just an information I just wanted to sell, and there is a very small amount of vitamin D and E also present into the natural ghee which we are talking about. So that's the explanation from my side, sir.
Sir, any more question that you would like to ask?
That's all for the moment. Thank you.
Okay, thank you so much, sir. So, विजय वर्गीय जी, thank you so much. हम सिर्फ एक चीज आपसे और पूछना चाहेंगे कि आपको क्या प्रीमिक्स प्रोक्योर करने में कोविड के टाइम्स में कुछ प्रॉब्लम आई थी? जस्ट एक संक्षिप्त में।
नहीं मैडम, कोविड के टाइम हमको प्रॉब्लम नहीं आई, क्योंकि स्टॉक में हम एट ए टाइम 5000 मेट्रिक टन का स्टॉक प्रीमिक्स का रखते हैं कि ब्लेंड 5000 मेट्रिक टन ऑयल हो जाए। 8% में हमारा स्टॉक मेंटेन रहता है। और हमने कोविड के टाइम अप्रैल और मई में जस्ट जैसे 1500 से हमने 3000 मेट्रिक टन पैक किया और सेल किया मार्केट। बट हमारा एक क्वेश्चन है प्रीमिक्स के बारे में,
वो सर नेक्स्ट क्वेश्चन में हम पूछ लेंगे, because we will be now giving the opportunity to the premix suppliers to talk and also for the quality assurance at the NABL lab. So I'm very grateful to Mr. Rajesh Vijayvargiya ji, who very clearly shared that edible oil when fortified was preferred and acceptable to all, and there were no issues with respect to quality. That gives us a lot of confidence that even at the MSME level, food oil fortification can be scaled up. Now, I would like to bring in Mr. Arun Omlalji to talk about premix, quality assurance, quality control at the premix level, its transportation, and it is blending with the food commodities to fortify them. So I would want to know that how did the lockdown impact the supply chain of premixes, whether it was to the industry, food industry, or to you, Mr. Arun Oblal? And may I also request others to kindly mute their mics because there is a lot of background noise.
Good afternoon, everybody. Thank you, FSSAI, FFRC, and GAIN for giving us an opportunity to speak on our micronutrient premixes and how we dealt with it during the pandemic, as well as what Hexagon is all about. First, let me answer Diptiji's question as to the challenges that we faced during the lockdown. In fact, Diptiji, during the lockdown, there were two sorts of challenges which we had. The first challenge was during the start of the pandemic, where there was a sudden lockdown, where we had challenges of continuing our unit to manufacture the micronutrient premix and the other products that we have. So going with that challenge, yes, the government was very helpful to us because usually we come under the Essential Commodities Act. And because of that, we were allowed to open up our units and function. But yes, we were functioning at that time, I think it was 20% of our capacity and restrictions on people. Still with that limitations of capacity, limitations of people, we had the challenge of logistics was also there because only essential commodities were allowed to be shipped. And like Ganesh rightly said, my biggest customer was Cargill, who basically wanted goods as per yesterday. So we had opened up our unit, so we were working at 20% with one shift and 20% of the workforce. With that, we saw to it we could fulfill the requirements of all our customers. Yes, there were some delays. The delays were for a lot of reasons, but we could help them out, we could support them out. And it is because of their support, we being in the essential commodities, we could start off our unit. So yes, challenges were there, they were overcome. The second challenge basically is the recent 2 months challenge where your unit is running, but then you've got COVID patients coming in. Now, because of that, you have to shut down your unit. Now, that's again one of the biggest challenges. That's why I said there are two sorts of challenges which we had, but here we took a strategic call. The advantage which companies like us is we've got 3 units. And 3 units are stationed in different part of our country. So we could operate and make premixes in other parts of the unit and supply them pan-India. So there were challenges, but the limitations were overcome and we were helping out our customers. One thing really I would like to say, we never increased the price. Irrespective of my friends would understand that, irrespective of the output prices going up, we did not increase our price and it remained the same till date. The reason why we did that, because I remember there was a commitment which we had given to CEO FSSAI, Pawan Agrawalji, when we had a first discussion along with GAIN. And we had committed to him, we will restrict, and as everyone is doing it mandatory, we will also put in our responsibility and see to it the right price and the right quality goes. If given an opportunity, I just need to put in 5 minutes. I was just speaking to the CEO before the event. I would like to put on place, which is very important. Micronutrients and nutrients basically are food grade nutrients. Yes, in terms of quality control and QA, the nutrients are divided into food grade, medical grade, and animal grade. But for food, we always use the food grade, and we are regulated by FSSAI on the particular requirement as to how the food grade is done. So I would answer this first question. It is a food grade ingredients and the grades that we use. Second, Dipti ji has, I would also like to emphasize on the quality assurance. What is the quality assurance a premix manufacturer needs to do? One thing which is very, very important is what should be the accreditations? What is the certification? The certification which is required internationally as per GAIN standards, I would say, and as per UNICEF standard is, one has to have GMP, which is a must, which is good manufacturing practices. The second certification, which is a must again, is Food Safety Management System, which is FSSC 22000, which has to be robust, because only on the basis of that you have the right quality of the product coming out. Halal and kosher certificates are part of it, because there would be different countries where we are exporting to which requires the halal and kosher certificate. ISO 9001 2015, which is the latest quality management system which is there, which has to be adhered to. The last but not the least, which is very, very important, is testing and analyzing your not only the final product, but the raw material which is coming in. And one has to have the certificate, which is ISO IEC 1725-2005, which is a must in all organizations. Once you have these robust certifications with you, you are assured of the quality assurance which you are giving in terms of raw material and finished goods, and the quality control which you are doing while processing the goods out there.
Thank you so much. Thank you so much, Arunji, for explaining the quality assurance, quality control mechanisms that you have in all the premix plants run by you. And as has been assured by our Honorable CEO, sir, that FSSAI would give very great emphasis on ensuring that the premixes are premix suppliers are audited and the quality is ensured. One last question in very short answer I want is that how much of overages do you add? Because in premixes, adding of overages is a must, because there will be little bit of loss during cooking, storage, transportation, etc. And at the end product level, we keep talking about that added micronutrients are stable, and they would be having adequate micronutrients present at the time of cooking and also when the food is cooked. So would you like to just briefly tell us about it?
Yes, very much. In fact, overages are dependent upon two parts. One is what is the potency or what is the assay of the nutrients which you have. Two, the product and the shelf life which you intend to give for the final product. So based on these two analyses, we do the formulation of the premix depending upon the food application, and average it roughly works to between 10% to 15% per nutrient. And that is also dependent upon the type of nutrient. Is it either vitamin A or D2 that we particularly use in oil and the milk product?
Thank you so much. Now, may I please request Dr. Preeti to be online, and we would like to request her to tell us about the challenges that are faced in testing micronutrients when they're at such low levels. How are they detected, and can any and every lab test for those micronutrients, or there have to be some special procedures? Over to Dr. Preeti Amritkar. Dr. Preeti, you will have to unmute yourself.
Oh, yeah. Hello. Thank you, and thank you FSSAI for organizing this webinar. It's a great effort, and I hope that we do make an impact with this webinar. Awareness is created. So to answer your first question, what are the challenges faced by any NABL accredited lab? The first challenge that the lab faces is the test method. The test method is the heart of any measurement process. And if the test method choice is or the selection is wrong, the results, the outcome would be wrong, and the entire focus is shifted to somewhere else. So I think selection is very important. Then once the method is selected, it has to be verified by the lab. And if the method is not a standard international method, the lab has to validate that test method to, so that the lab can prove that it is fit for purpose. That is, the lab is able to quantify the trace levels of vitamins A and D and other such nutrients at the levels of fortification that have been prescribed by FSSAI. For example, vitamin A, the prescribed levels are 6 to 9.9 milligram per kg. So the test method should be able to quantify these vitamins, this vitamin at a level less than 6 milligram per kg. Now, I think vitamin D2 and D3 are more of a challenge as compared to vitamin A, because the levels of fortification are really low. They are just 0.1 to 0.16 milligram per kg. So that is a very, very low amount. And as such, you all are aware that vitamins are very sensitive to temperature, oxygen levels and light, etc. So the test method is very important. Now, internationally, if you see edible oil matrix as such, there are no methods for the edible oil specifically for vitamin A and D, but there are some other methods available and which can be applied or extended to analysis of these vitamins in edible oil. Now, last year, a scientific panel of methods of sampling and analysis of FSSAI, they have released this order, 2019 order, wherein they have recommended a few methods for various fortificants. And in that case, for vitamin A in edible oil, they have recommended a method of AOAC 2001.13. Now, this particular method is a HPLC UV based method. And although this is a good method, this has not been typically studied for edible oil matrix by AOAC. So the labs have to do their homework. They have to spike, they have to validate the method, and they have to verify that this particular method can actually achieve a LOQ of less than 6 milligram per kg. And so this is an extra mile that the labs have to do. Now, as far as vitamin D method is concerned, FSSAI has recommended two methods. One method is for D2 and the other is for the D3. Now, D2 generally is a plant-based vitamin, and therefore a lot of times D2 only is found in the edible oils. And the method recommended for D2 is AOAC 2016.05. Now, ideally, this particular method is studied for the infant food and adult nutritional matrix, but it does work well for edible oil, and it is also able to achieve the LOQ of less than 0.1 milligram per kg. But there is a lot of the method is not very easy. It involves a lot of procedures. It involves a costly use of expensive internal standards which are isotope labeled. And the isotope labeled internal standards, generally they are extremely costly, like 1 milligram may cost around 84,000 to 1 lakh. And the expiry of these standards also is very less, just 6 months. So the lab has to do these recurring expenses. Also, they have to validate the method and get it accredited under the NABL scope. And so that is one challenge that these are some of the challenges that the labs face. And when you asked about how many labs can do it, I think there are a lot many labs in the lab in India, and a lot of labs do undertake these kind of testing. But it is important to see whether they are really accredited for the range of testing. Okay, and I think this information is available freely on the NABL website. You can download the scopes of every lab, and you can check, what is the range and what is the methods, what are the methods that the labs are using. So, but the important thing, as I said, is that it is very important to check the range of testing. So that's about it. Yeah.
Thank you so much, Preeti ji, for explaining so well. आपने बहुत अच्छे से बताया कि बहुत labs हैं इंडिया में. There are many labs that can test for vitamin A and D. So हम पूरी in food industry and the development sector partners and FSSAI feel very confident. Secondly, आपने ये भी methods भी बताए हैं कि कौन-कौन सा method use करके test किया जा सकता है. So once you have shared the protocols for different methods, I'm sure many labs would adopt those methods and also approach FSSAI for providing training, because I have worked with FSSAI for some time, and we've been continuing to work with them on the quality agenda, and I know that FSSAI is very, very keen to scale up fortification with quality. So they are laying a lot of emphasis and building the capacity of premix suppliers, the edible oil industry, as well as the labs to scale up their testing methods, their processes of fortification, and so that consumers also have confidence. So thank you so much, Preeti ji, on that.
I just have one more point here. Is that would also like to share, what support we can expect from FSSAI from GAIN as well. Is that I think awareness now you're doing, that's a very good thing. But I think conducting some kind of a PT program or ILC, interlab comparison programs will be very useful.
Yes.
That you can also benchmark the competency levels, and if there is some gap, we can always harmonize the methods and we can go forward, because just having one lab doing all the tests, that's not going to help. So you will have to have more labs which would come in and this program to make a success. So I think GAIN must look at, or FSSA also must look at organizing such programs. And but just that
I want to assure you on that, Preeti, that GAIN has a large-scale food fortification quality assurance agenda, under which we are doing peer review. We are also doing the cross-testing, testing of protocols, and we are very, very sensitive that the quality of edible oil, which is fortified, should be recognized and talked about, so that people have confidence that if they're buying a oil which is supposed to be fortified, is actually fortified at the levels which are on the label claim. And we are also looking at building the capacity in partnership with FSSAI, building the capacity of the labs as well as of the premix suppliers, so that at the user level, industry user level, there is no problem for getting the premix and also testing for their end product. We are also sensitizing and training the food safety officers in partnership with FSSAI, so that no one is unduly put into trouble just because one lab showed the results that there was no micronutrient, though they were present, and it was the fault of testing, or it was some protocol issue. So those are the kind of things that GAIN is doing. So hum sabko, whether it is food industry partners, consumers, premix suppliers, हम सबको ये बहुत assurance दिलाना चाहते हैं कि GAIN और FSSAI दोनों मिलके बहुत मेहनत कर रहे हैं कि हम quality assurance का एजेंडा बिल्कुल foremost रखें, सबसे अग्रिम रखें, so that there is no compromise on quality. And when we are talking of, जैसे CO सर ने और FSSAI डायरेक्टर इनोशी मैम ने बोला कि मैंडेटरी फोर्टिफिकेशन को बहुत जल्द अनाउंस कर दिया जाएगा. So आपकी तो ये कहना ही हमारे लिए बहुत इमोशनल और बहुत बढ़िया बात है सर और मैम, बट हम आपको ये अश्योरेंस देते हैं कि हम प्रीमिक्स सप्लायर्स के साथ, इंडस्ट्री पार्टनर्स के साथ और लैब्स के साथ मिलके we will ensure that we scale up edible oil fortification with quality. So with this, I close the panel discussion. Now we will be having an open house and question and answers, but due to technical glitches that we are facing today, unfortunately, we would not be opening it for the audience to ask questions. My colleagues have been sending out messages and there have been a lot of questions that have been compiled. Even though we will not be able to answer all, मैं request करूंगी अपनी colleague शकुन से कि वो एक एक करके 5 key questions बोलें और हम उन specific questions को request करेंगे for specific speakers जो उनको जवाब देंगे. और आपने जो भी participants ने जितने भी questions पूछे हैं, हम आपके सारे क्वेश्चंस की, आपके इंटरेस्ट की और आपकी पार्टिसिपेशन की बहुत कदर करते हैं. आपका एक एक क्वेश्चन हमने नोट डाउन किया हुआ है. वी हैव नोटेड ईच एंड एवरी क्वेश्चन एंड वी विल रिस्पॉन्ड टू ईच एंड एवरी क्वेश्चन, एंड ऑल दीज क्वेश्चंस वुड बी ऑन द FFRC FSSAI वेबसाइट विद प्रॉपर आंसर्स. सो अगर हम सबके क्वेश्चंस, हर एक का क्वेश्चन ना आंसर कर सकें तो उसके लिए मैं आप लोगों से सबसे क्षमा मांगती हूँ. पर ओवर टू शकुन नाउ. शकुन, आप प्लीज एक एक करके क्वेश्चन पढ़ें और फिर हम उन क्वेश्चंस को आगे पास ऑन करेंगे अपने एस्टीम्ड स्पीकर्स को.
Sure. Thank you so much, ma'am. We have received so many questions and many of them are quite repetitive. So I've collated a few and I'll just read out and then you can direct it to the concerned person. So first question is, many of people have asked that our Indian cooking involves very high temperature for different kind of preparations and vitamins are heat labile. So what is the bioavailability of these vitamins? And also as our atmosphere is quite hot and humid, so what is the loss of vitamins during transportation and storage?
ये तो क्वेश्चन मैं ही आंसर कर देती हूँ, क्योंकि ये क्वेश्चन जब हम फूड फोर्टिफिकेशन की बात करते हैं तो ये बहुत बार हमारे सामने आया है। और इस क्वेश्चन को अगर हम जब भी इस क्वेश्चन को हमने लिया है तो हमने ये भी देखा है कि बहुत स्टडीज की गई हैं जिनमें ये पाया गया है कि अगर हम तेल को 3 बार फ्राइंग करते हैं, एक बार हमने फ्राइंग की, उसको ढक के रख लिया और 2 दिन बाद 3 दिन बाद उसको दोबारा यूज किया फ्राइंग के लिए, फिर कुछ दिन रख दिया, फिर तीसरे बार उसको दोबारा फ्राई कर लिया, तब भी जो माइक्रो न्यूट्रिएंट्स यानी विटामिन ए और डी उसमें डाले गए होते हैं, उनकी जो पोटेंसी है वो केवल 20% ही कम होती है। नॉर्मल कुकिंग में जब हम सब्जी बनाते हैं तो उसमें उनकी पोटेंसी कम नहीं होती, जितना डाला गया है उतना हमारे शरीर को प्राप्त होता है। 3 बार फ्राई करने के बाद उसकी पोटेंसी लगभग 20% कम हो जाती है। और तीसरी बार के बाद तो उस तेल को फ्राई करना ही नहीं चाहिए, क्योंकि वो हमारी फ्राइंग के काबिल ही नहीं होता है। उसको हम फिर FSSAI के वेबसाइट पे जाके आपको पता चलेगा कि वो ऑयल जो है उसको रीयूज करने के लिए गवर्नमेंट के अपने प्रावधान है, जिनके बारे में यहाँ पे मैं चर्चा नहीं करूंगी। तो इसलिए आप निश्चिंत हो सकते हैं कि जो भी माइक्रोन्यूट्रिएंट्स डाले जाते हैं वो उसी मात्रा में हमारे खाने में रहते हैं, चाहे हम सब्जी बनाएं या हम उसका छौंक लगाएं, पराठे तलें। सिर्फ 3 बार फ्राइंग करने के बाद पोटेंसी 20% कम हो जाती है, और कुछ हद तक क्योंकि उसमें ओवरेजेस डली होती हैं वो कवर हो जाता है। आई होप कि मैंने इस बात को आंसर किया है। सो द पोटेंसी ऑफ माइक्रोन्यूट्रिएंट्स व्हिच आर एडेड रिमेन्स constant while we are doing the normal cooking, making parathas, vegetables and curries. It only reduces by about 20%, where 20 to 25% when we are frying it, and at the 3rd frying level. After that, oil is no good for cooking and it should not be used.
Thank you, ma'am. Thank you, ma'am. Then another question is about fortifying cold pressed oils like coconut oil, and if there is any procedure prescribed by FSSAI. So people basically want to know about if they can fortify cold pressed oil also.
May I just request our friend from Marico Industries, Mr. Shailesh, to respond to this? Shailesh ji, आप इसके बारे में कुछ बताना चाहेंगे?
Yeah, this is Shailesh. In fact, definitely, we definitely can have this fortification for the cold pressed oil and the coconut oil. And I think, but if you see this cold pressed oil or the coconut oil or any of the filtered coconut oil, they have inherent nutrients which are already present there. Okay, and I think that is the most important advantage of that, because any cold oil has an inherent nutrient which comes with any of the seeds, whether it is groundnut oil or whether it's a coconut oil or whether it's a soybean oil. And yes, that's a possibility. We can do it.
Thank you so much. Hanji Shakun, next question, please.
Next question is, people are saying there are some brands who are adding vitamin E and C. This is basically for FSSAI, that there are some brands which are adding vitamin E as well as C in fortified oil. So how is it possible if there are standards only with vitamin A and D, if they could put some light on it?
For this question, may I please request either CEO sir or Inoshi ma'am to kindly respond.
Okay, so I just replied for this. Basically, for a plus F endorsement, you have to follow the regulations as they are prescribed. So if anybody is adding anything extra, then it does not come under the plus F ambit. So C and E is not part of our regulation. Only A and D are.
Thank you so much.
Thank you so much.
And मुझे लगता है कि अब ये सबको पता चल गया होगा कि विटामिन ए और डी तो मैंडेटरी है अगर हमने प्लस एफ का लोगो लगाना है। विटामिन सी और ई कुछ ऑयल्स डाल रहे, कुछ ब्रांड्स डाल रहे हैं विटामिन ई, और जो पहले से ही डाल ही रहे हैं, कुछ ने सी भी शुरू किया है। और अगर उन्होंने सी शुरू किया है तो अगर कुछ भी चीज अगर आप एडिबल ऑयल में डालते हैं तो उसकी परमिशन FSSAI से लेनी पड़ती है। सो जो डाल रहे हैं उनको प्रायर परमिशन लेनी आवश्यक है।
Yeah.
Next question.
Another question is, can we fortify snacks like specifically bread, biscuits, and namkeens?
Again, may I request Enoshi ma'am to respond?
So at present, like I mentioned, processed food cannot be fortified. The regulations for adding fortificants while preparing processed food is underway. Very shortly, maybe another couple of months, we should be having a regulation. Then we will be prescribing what are the limits and which types of processed food can be done. So in all probability, in fact, foods which are high in salt, fat, and sugar cannot be fortified. But other processed foods like maybe your bread, buns, noodles, and your pasta can be.
Thank you so much, ma'am, for clarifying. Because bread पहले भी vitamin B, vitamin से enrich होती थी, modern bread को enrich किया जा रहा था, और कई ऐसे products हैं जिनके अंदर micronutrients डाले जाते हैं to fortify them. So but they cannot put a plus F logo. Plus F logo can only be put for the staples which are being fortified with the standards that have been gazetted, recommended and gazetted by FSSAI. Am I right, ma'am?
Yes, absolutely, absolutely.
And अगर कोई भी food company कोई एक नया product बनाती है जिसके अंदर वो micronutrients बहुत सारे add कर रहे हैं, तो वो staple food category में नहीं आता है, और वो उसके लिए स्पेशल परमिशन या उसकी डिक्लेरेशन लेनी पड़ती है, और वो प्रोप्राइटरी आइटम्स होते हैं। सो अगर कोई प्रोप्राइटरी आइटम बना रहा है और उसकी अप्रूवल उन्होंने ली है, सो सबसे इम्पोर्टेंट क्या है कि अगर आप कोई भी फूड मैन्युफैक्चर कर रहे हैं तो उसका फूड लाइसेंस आपके पास होना चाहिए, जैसा कि FSSAI हमेशा कहती है, और उनका लाइसेंसिंग सिस्टम है। सो एनीथिंग इफ यू आर एडिंग टू एनी फूड प्रोडक्ट, फर्स्ट you have to register, you have to declare, you have to take permissions, and with the permissions accorded, you can add any micronutrients to your food products and make it a proprietary item. Today we are actually discussing staple food fortification, and in that also edible oil fortification. But when we are talking about staple food fortification, there are 5 staples: oil, milk, wheat flour, rice, and double fortified salt, for which FSSAI has very kindly gazetted the standards, and we use those standards and we put the plus F logo, and that makes it the complete story. Shakun, next question, please.
Yeah. Another question is, for a smaller FPO, what are the basic facilities which are needed to fortify edible oil?
Again, may I please request Mr. Rajesh Vijayvargiya ji, अगर आप बताना चाहेंगे कि क्या हमको कोई स्पेशल इक्विपमेंट लगानी पड़ती है अगर हमने स्मॉल स्केल पे फोर्टिफिकेशन करना हो तो? ओवर टू राजेश।
हेलो मैडम। इक्विपमेंट लगाना पड़ता है मैडम उसमें। एक्चुअली में एजिटेटर और एक टैंक होता है सेपरेट, इसकी क्वांटिटी 5 मेट्रिक टन या 10 मेट्रिक टन होता है। उसके लिए हमको 45 मिनट उस ऑयल को सर्कुलेट करना पड़ता है, और सर्कुलेट होने के बाद में फिर उसमें विटामिन ए और डी जो है उसकी टेस्टिंग करते हैं। तो स्पेशल केस में एक टैंक चाहिए और एजिटेटर चाहिए मिक्सिंग करने के लिए।
Thank you so much. So what Mr. Vijayvargiya is saying, that when you are processing oil, at the last stage, most of the people are also adding antioxidants. At a small scale, perhaps you may not be adding antioxidants, but I just want to say that it is very important that your oil has low peroxide value, and your free fatty acids should also be in line with the specifications of FSSAI. तभी आप अगर माइक्रोन्यूट्रिएंट्स डालेंगे तो फोर्टिफिकेशन सक्सेसफुल होगा। दूसरा, जैसे like Mr. Vijayvargiya explained, there are tanks which are 5 ton, 10 ton capacity. We have customized bottles for each tank, and then there is an agitator. Agitator means it is something like a stirrer जो घुमाते हैं और वो अंदर mix करता है, which mixes the premix with the oil. Since premix is also oil based, blending is not difficult. So it is not a huge cost, nor is it a very complicated equipment. It is easily available in India at a very minimized cost. So even a small, medium segment if oil industry can fortify. Now, Shakun, next question, please.
Dipti, I have one just point here, Dipti.
Yes.
Just to add, I think the most important aspect in this entire manufacturing is the accuracy of addition of this premix what you receive, A and D. I think if you taken care of that, I think that your FG is bound to comply. So I would just guide everyone that I think the addition is the most important point, right quantity of addition.
Yes.
And if you take care of your in process, your FG is assured.
Yeah, I just want to add one thing, that when we are supporting and promoting fortification of edible oil, we have specific bottle size for 5-10 tank. So for every tank of 5 ton, there is a customized size of bottle filled with premix, so that everyone at the industry level or anyone at the industry level does not have to measure and weigh or calibrate the addition. So if you have a tank full with 5 ton, you add 1 bottle, blend, you make a pre-blend and add it to the tank and do the stirring for 30 to 45 minutes. And as you rightly said, it would be fully blended and there would be no quality issues. So to support the industry, the packaging of premix is customized to per 5 ton tank. And if you are adding it in 10 ton tank, then you just have to add 2 bottles. So that is taken care of. Shakun, next question, please.
Yeah, so there are many questions around supply of fortified oil through public distribution system, because most of the malnutrition problems are seen in lower income groups and we have already enough amount of brands. So how can government ensure that this is actually reaching the last mile, including BPL categories? So that is one question.
Again, for that, may I request Dr. Shankar to respond, if Dr. Shankar is able to connect. Dr. Shankar?
Okay, let me answer that since he's not able to connect.
Sure.
Once we make fortification mandatory, then this problem would be over completely, because all oil would be fortified, so it will reach everywhere.
Thank you so much, sir. And I also want to add that wherever GAIN is working in whichever states for oil fortification, we make a list of all the brands that are fortified, and we share that list of brands of fortified oil with ICDS and MDM, requesting them to buy any one brand or any brand of their choice, so that the brand that they are using is fortified with A&D, and the meal that they are preparing is made with fortified edible oil. So, and I think, sir, please advise if we should have more questions, or should we conclude now with concluding remarks by Tarun Vij and give all the responses to the questions on your website?
I think we should leave something for the next webinar also. This is not
Exactly.
the last one.
Thank you so much, sir. And so may I please request Mr. Tarun Vij to give his concluding remarks and propose a vote of thanks. Over to Tarun Vij.
Very, many thanks to CEO FSSAI, Director FSSAI, all the esteemed panelists, and all the participants who came in large numbers to attend this very informative, enriching conversation today on scaling up edible oil fortification, commitment to action, the way forward. I'm just going to summarize 2-3 takeaways and not go to it at length. So 69% edible oil voluntarily fortified. We are ready for mandating it, and we were delighted to hear that some action towards this will be initiated very shortly along with milk fortification, and that this will be enabling universal access and not selected access based on. So whether it is social protection schemes, open market, wherever oil will get access for the consumer, this oil will be mandatorily fortified. We have a responsibility as industry as regulators, as labs, to ensure that we provide customer good quality, and good quality is our responsibility. Good quality will require premix compliance will be critical to it. Therefore, the need for premix standards, quality accreditations, appropriate manufacturing practices, so that what we are delivering steadily improves, and at all levels of different levels of sophistication of manufacturing, we are compliant at all times on quality. The last thing that I took away was that even for our lab methods, given that we will be testing for micronutrients, it is extremely important as to what is the test method chosen in order to ensure that we are appropriately utilizing lab capacity across the country. We will need to harmonize methods across labs and create some sort of engagement platform on an ongoing basis that appropriate sharing of best practices across labs also happens. So many thanks to everybody who devoted their 1.5 hours to be with us. It has been a very enriching discussion today. Thank you.
Thank you.
Thank you everyone for a very enriching discussions. Thank you everyone for your time. Special thanks to CEO sir and Enoshi ma'am to have led this agenda of food fortification. Great thanks to all the participants who have been here. And I assure you and promise you all your questions will be answered, and they would be available on the FFRC FSSAI website. And for me, it has been a very encouraging experience, and very happy to hear, sir, that you would be announcing mandatory fortification very soon. So it would be a dream come true from our side. Thank you so much.
Thank you again. Thank you, Tata Trust.
So we close the seminar now, and please fill up your feedback forms, and we would also be sending out the certificates of attendance. At the last thing, we have shared with you the mementos to all the speakers. May I please request all these speakers to show their mementos so that we can, have a picture for memory, if that's okay with you. We'll be so grateful. So we can, all of us can be on the screen. So unmute your video, show your...
Yeah.
Show yourself and your memento, if it is possible. Thank you. So I'll request my team to kindly take a picture.
Sure, ma'am.
And
thank you.
Thank you. So we close the seminar now.
Yeah.
Thanks, everybody.
Thank you.
Thank you once again.
Thank you, Dipti.
Thank you.
Thank you, Dipti.